Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with my friend and the front desk lady, Lisa Marie Spradley. How are you this morning?
I'm doing great, Kevin. How are you this morning?
Doing well. Thank you so much for taking a few minutes, as always, to chat with
Welcome.
us.
Love to be with you.
So we're going to talk about a topic that every dental practice has to deal with at some point in its lifespan, and that is the art of hiring. And
hmm
I know, Lisa Marie, you've done your fair share of hiring, right?
Oh, I have, and not always with the best results.
Well, what does that mean? Tell me a story.
I can tell you that there was a time I hired someone. I actually, in the first process of going through my resumes, I found a resume of someone that I had liked, but when I contacted her the very first time, she had accepted a job somewhere else. So when I was looking again, I went through my previous resumes and I saw this one and I remembered her, so I said, I'm going to call her. So I called her and she was willing to come in and interview, and I was so excited because she had the experience. And I made the fatal mistake of just jumping the gun. And when she told me she was willing to work, I took her. And I want to tell you, she was employed with our office for not even 3 full months. And in that time, she showed up for work about 2 weeks.
Oh gosh,
She
wow.
constantly had an excuse why she couldn't come. And finally, I just, after coming in and finding another message on the machine why she wasn't going to be able to come in, that she would leave me at 2 a.m. in the morning, I just said, okay, we've got to stop. So I have learned, some important lessons, and like most people, I have to learn them the hard way. So I've decided that in the future, I'm going to hire to, fill a role, not a position, because that's what I was doing wrong before. I was trying to fill a position with someone I thought was qualified. And now I know I need to fill a role with someone that I know can, perform those tasks in a way that best represents our practice.
So I know that there's really some tips that you wanted to share that you've learned through this art of hiring that you have grown
Yeah.
in.
Well, it's really funny, Kevin, because like I said, I have to learn my lessons the hard way. So when I was reviewing what I had done wrong, and I knew that these were my mistakes, I didn't ask some very important questions. So I sat down and I wrote a list. Okay, so I'm going to ask these questions in the future. So here's what I do. When I hire someone now, I, immediately share, our vision in the practice, what we believe. And I asked the person who's interviewing, so why are you interviewing with us? What made you choose us? Why us? And I listened to their response. I'm always making sure I'm not asking questions that are just going to be yes, no answers. I want them to talk to me. I want to know, why did you choose us? And based upon their answers, I can tell immediately if they're going to be a good fit for our practice. The next thing I want to do is I want to tell them that, working with us, we always work hard to come together as a team and put our patients first, put our team members and our patients first. And I ask, what can they do to help us make sure that we're always putting, the team and the patients first? What skills do they have that can help us build these relationships? Because it's all about relationships. And if the team isn't happy, we're not going to make the patients happy. So I'm a firm believer in that. I know that a lot of people believe the customer's always right. And I worked at Walmart, I believe I told you this before, for many years with the mentality that the customer's always right, and they're not always right. So you want a team that's going to back you up, and especially your doctor. So knowing that we strive to keep an environment that is, team and patient focused, how can we make the patients feel welcome? And as a team, how can we make the patients feel welcome in our practice and not feel like a patient, but, as a guest? Because I'm real big on that. Once again, going back to the relationships, I want them to feel like they're a guest in our home. So how can you help us achieve that goal? So it's, why do you want to work here? What can you do to help us work together better as a team? And how can you help our patients feel welcome in our practice? Those are the 3 questions that I always want to ask a prospective team member, and they give me a much better fit. I can tell you that I haven't had to hire anyone in a few years once I incorporated that into our practice.
Great questions to ask. Is there an answer that you always perceive as, oh, that's a red flag? I'm not sure that, that's really a
Oh,
warning.
well, like when I am asking someone why they want to work here, it's like, well, I saw your ad in the paper. I want, and I don't think I'm unrealistic this. When I speak to other practice managers, they tell me the same thing. I want someone who's going to do their homework. I looked your practice up online, and I love that your doctor uses the CERIC, or, I love that you do team retreats, whatever it might be. I want someone who's actually taking the time to look into what we are and who we are. So that's a red flag. And then, if they're giving me answers to questions that just really aren't well thought out, they always say, ask them, what's your biggest oh gosh, like, what do you have problems doing? Or, what was your biggest problem at your last job? And if they tell you, well, they didn't have one or something like that, you know that that's not right. We all have something that we don't excel in. So what is that? And be honest with it. So those are red flags for me. I want someone to be truthful with me. If you know you have a problem in the area or in an area, as long as you're not telling me you can't count for my front office, then we can always work to get past certain inadequacies. But what we can't get past is just a fundamental disconnect in our beliefs.
Great points, my friend, as always. Thank you so much for sharing. And obviously, I want people to know where they can reach you, the front desk lady, for more information on what you do and how you can help their practice.
Oh, I'm glad to help anyone that I can. The easiest way to reach me is my website, frontdesklady.com. You can email me there, Lisa Marie at frontdesklady.com. And of course, if you're interested, sign up for my newsletter. I do a monthly newsletter, and I've got some new stuff coming, Kevin. I'm not going to share it with you right now. It's a surprise, but I've got some big stuff coming I'm really excited about.
Well, then I'll just have to look forward to the next time that I see you and the next time we chat, and you can tell me all about it. That'll be great.
That'll be great. Yes, sir.
All right. Thanks so much, my friend. Have a great rest of the day.
Thank you. You too, Kevin.